This is Greg Kesich at the Portland Press Herald, and I'm with Dr. Dustin Sulak from Integrate Health Systems. It's Integrate with an 8. And Dustin is a leading proponent, is that fair to say, of the use of cannabis in medical settings?
That is fair to say.
Okay. Well, we've had medical cannabis, medical marijuana for a number of years in Maine, and there is, I think, a public perception that for very sick people it's a humanitarian gesture, but there's a suspicion that it's also a roundabout way for people to get marijuana to get high for fun. And how do you deal with that perception in your line of work?
It's understandable why there's so much confusion about this topic, because over the last several decades there's been a lot of misinformation. And during that time, a lot of new science has come out that has shown that this plant and the compounds in it can be really useful solutions to a lot of our biggest problems in medicine today.
What are some of the conditions that you think it's a good application of medical cannabis?
So one of the biggest things that people come to us for is chronic pain. And I think a lot of us are aware of this problem, that there's not really good treatments that are long-term and effective for chronic pain. A lot of people that use opioids, for example, end up building tolerance to the opioids and requiring dose escalation after every few or 6 months. And what happens is the therapeutic index of that drug starts closing. So this would be the lethal dose, this is the effective dose, and every time they get a dose increase, they start getting closer to that danger zone. And a lot of people find themselves in dependence and addiction. So cannabis is one example of a great solution to that problem. So that's one example, but pain isn't the only thing that we treat. We treat PTSD, we treat inflammatory bowel diseases, we treat neurological conditions like MS and seizures. It sounds a little hard to believe that one herb can do so much.
Yeah, that's sort of I think the source of a lot of the skepticism is that we're not used to seeing medicines that are used for both PTSD and bowel conditions. You know, that just seems like such a range of physical and emotional, spiritual, psychological conditions. But you're saying that this one plant is effective in all these areas.
I was skeptical also, and I think, you know, any trained physician should be skeptical of this. It makes sense, because you're right, this isn't the model that we're used to working under. We think of the silver bullet drug that has a single effect. The thing about cannabis is that when researchers started looking for how does it work, specifically how does THC work in the body, they discovered a whole new physiologic system called the endocannabinoid system. And now 20 years later, we know this system is an integral part of our potential to heal and to maintain balance despite fluctuations in our environment.
So as a practitioner, are you making any kind of different judgment writing a certificate than you would writing a prescription for a pharmaceutical?
It's a similar clinical thought process. We put all the treatment options on the table and evaluate the risks and benefits. So even if someone comes to us specifically wanting cannabis and we realize, hey, there actually is a conventional treatment that's probably safer and more effective, why don't we start there? We'll definitely say that and suggest that. The thing is, most of the people
How
that
do they
make
respond?
Oh, actually, they're quite. Most people are really happy that we listen to them and that we believe that cannabis may be a helpful part of their situation, because so many other people in the medical field instantly turn on the judgment and don't even consider that possibility.